Hello and welcome everyone to my presentation. My name is Justine Lebec and I'm a Research and Evaluation Officer at the Canadian Observatory on Homelessness. In my presentation today, we'll explore how we can support frontline workers in the homelessness support sector, both during and after the COVID-19 pandemic. And as we know, frontline workers are critical components along the path to ending homelessness. And so I thought it was only fitting to title this presentation with a quote from one of our participants demonstrating the importance of this workforce. So they said, even during the pandemic, we needed to show up. We couldn't close the doors. And with this presentation, I hope to leave you with three key learnings. The first being to understand the experiences of frontline workers in the homelessness support sector as it relates specifically to precarious employment, employee retention and turnover, training and professional development, and discrimination. Second, a lot of research has come out about the impact of COVID-19 on other populations of frontline workers and essential workers, most specifically healthcare workers. And this research will seek to enhance your understanding of just how the COVID-19 pandemic has impacted this unique population of frontline workers. And lastly, I will identify strategies based on this research that can help organizations and decision makers in the sector better support their frontline workers moving forward. And just a little bit of background about this project. Reaching Home partnered and funded Hub Solutions to research the needs of frontline workers in the sector. And Hub Solutions is a social enterprise embedded in the Canadian Observatory on Homelessness, which is housed at York University. And this research was guided by 4 questions. 1, what are the key skills required to work in the sector? What is the magnitude of precarious employment, employee retention and turnover, and discrimination experienced by staff in the sector? What existing resources and supports are in place and offered to workers in the sector? And what policies, regulations, sector standards, resources, and supports exist in the sector or are needed to protect workers? And in terms of methods, we used a mixed methods approach for this research. And this included a literature review to provide background on the employment and working conditions, as well as common challenges experienced by frontline staff in this sector. We reviewed 100 job advertisements that were posted on 12 different job boards across Canada between January 18th and February 26th, 2021. We also launched an online survey for frontline workers to respond to. And the survey was open from April 1st to April 25th, 2021. And we also interviewed 15 executive directors from homeless serving organizations across Canada. The interviews were thematically analyzed, and then descriptive statistics were generated from the survey and job advertisement data. And the results that I'm going to discuss in this presentation today will focus specifically on the data that was generated from the survey and the interviews. So in terms of socio-demographics, as I mentioned, we interviewed 15 executive directors, and 33% of those were located in Ontario, 20% in British Columbia, 13% in Alberta, and 7% from Quebec, Manitoba, Prince Edward Island, and Nunavut. 11 of these executive directors identified as female and 4 identified as male. The majority, 75%, identified as heterosexual, and again, the majority, 83.6%, identified as Caucasian, compared to 15.4% who identified as Black, Indigenous, or other people of color. And in terms of education, almost all of the executive directors held some form of post-secondary education, with the majority, 35.7%, completing a graduate degree. And then in terms of the socio-demographics among the frontline workers who responded to the survey, similar to the executive directors, the majority, 50.4%, were located in Ontario, followed by 16.5% from British Columbia. And then we had a small number of responses from every other province and territory, except for Nunavut. And slightly more frontline workers, 20.3%, identified as Black, Indigenous, and other people of color compared to the executive directors. But similar to the executive directors, the majority identified as female, and then the majority also identified as heterosexual. And then more frontline workers tended to hold a bachelor's degree, 46.4%, compared to executive directors who again tended to hold a graduate degree. And among this population, among these participants, 23% identified as individuals with lived experience of homelessness. Key findings of this research. So we will begin by looking at the precarious employment in the sector. And precarious employment is characterized by low income and low wages, limited or no benefits and statutory entitlements, and non-standard employment. And these survey respondents were categorized as being precariously employed if they indicated that their term of work was contract, temporary, casual, or relief. So in terms of non-standard employment in the sector, almost a quarter of frontline workers were categorized as being precariously employed. And then unsurprisingly, 60% of the executive directors during the interviews discussed unstable or non-standard employment being an issue specifically among part-time, casual, or relief staff. And these executive directors also noted that casual and relief positions are just typical components among homeless serving organizations. In terms of benefits and supports, 22.3% of frontline workers said that they do not have access to health insurance through their work or through other sources. And 38.3% said that they had less than 8 paid sick days available to them. And that's important to note, given that if they contracted COVID-19, they would not have enough paid sick days to self-isolate. And then 70.7% of frontline workers also said that they do not have access to or receive specifically mental health sick days. In terms of wages, there was consensus across both the frontline workers and the executive directors that frontline staff are not being paid adequately. So 62.6% of frontline workers said that they were not adequately compensated for the work that they do, and 66.7% of executive directors echoed this sentiment and said that they felt their staff should receive higher wages. Now, in terms of employee retention and turnover, we know from existing research that high rates of turnover and low rates of retention exist in this particular sector, and our research supports these previous findings. So in our survey, almost a quarter of frontline workers said that they did not expect to be in the same role in 12 months. And then a significant portion, so almost a third of the frontline workers who responded to our survey had only been in their roles for less than a year. And then more than half of the executive directors, 53.3%, discussed turnover and retention as being major challenges for their organization, regardless of the pandemic. And the executive directors also discussed how turnover dramatically increased during the pandemic. The executive directors also suggested that high turnover is particularly common among shelter workers, as well as outreach and case management positions. And I think the issue of turnover and retention, and perhaps a reason for this significant challenge in the sector, is described by one executive director with this quote. They said, "It's a tough job, and it's complicated, and it's hard on you. It takes a lot of headspace and a lot of resiliency to just keep coming in every day." Now, in terms of training and professional development, 95% of frontline workers felt that sector-wide training would be beneficial to them, but only 46.8% said that they participate in sector-wide training and technical assistance through their organization. And we also saw a disconnect in the types of training that were received by frontline workers compared to the types of training that frontline workers felt was needed to do their jobs. So this was specifically, a disconnect was specifically seen in 3 different types of training. The first being training to deal with aggressive and violent behavior. So 37% of frontline workers felt this type of training was needed, but only 24.8% said that they had received this type of training in the past. Similarly, 31.7% said they wanted training to deal with sexual harassment, and only 8.9% said they had received this type of training in the past. So there's quite a large disparity there. And then 31% wanted training about the issue of homelessness more broadly, and only 21.5% said they had received this type of training in the past. And the executive directors, the vast majority, 73.3%, said that they do provide regular training and professional development to staff, and they echoed the importance of offering regular training to their staff. However, it's important to note that 20% of executive directors said that they did not have financial resources available to offer regular training and professional development to their frontline workers. Now, in regards to the issue of discrimination, this was brought up during the interviews with the executive directors, with almost half of the executive directors reporting that their staff had brought issues related to racism and discrimination in the workplace to them. And these issues were related to racism and discrimination based on race and ethnicity, gender identity, sexual orientation, as well as lived experience of homelessness. So the executive directors described instances where their staff said clients had made racial comments or slurs toward them, particularly to staff who identify as Black and Indigenous, as well as female staff who were not being hired in certain positions. And we also heard examples of pay inequities that continue to exist between male and female staff. And there were also examples given where staff with lived experience were being distinguished or singled out from staff without lived experience of homelessness, resulting in exclusionary work practices. Now, turning to how COVID-19 has impacted the sector, we asked a series of questions about COVID-19 on the survey, which revealed that just over half of the frontline workers, 51.4%, said that they are working more hours during the pandemic. And yet less than half had said they were receiving pandemic pay in the past 12 months. And again, we asked this in April 2021, a couple months ago. So evidently, frontline workers were working more hours in environments where they're at a high risk of contracting COVID-19, and yet we're not receiving pay increases aligning with the added risk. We also heard that 32.6% of frontline workers did not report that PPE was readily available to them in their jobs, and 46.4% had not received any type of COVID-19 related training in the past 12 months. So given that PPE training and increased hours were reported by frontline workers to executive directors, it is not all that surprising that we heard during the interviews from executive directors that safety and mental strain were major challenges brought to them by their staff. And mental strain included things like burnout, fear, and anxiety, and safety related to COVID-19, in particular, workers described concern about contracting COVID-19 themselves or bringing COVID to their families at home. And both these issues are exemplified by quotes from two different executive directors. So the issue of safety was described by one executive director, and they said, the feeling was they, clients, could have been with anybody. Like, we had quite strict rules in the shelter and people would just absolutely flaunt the rules. And it was like, oh, no, no, no. And so people did feel very unsafe. Yeah, because if people are living at risk, this COVID-19 was just one other layer of risk that they weren't heeding. And then in terms of mental strain, another executive director said, honestly, managing mental health on the part of staff has been the greatest challenge that the pandemic has brought, which, fair enough. I mean, I completely understood. I got to work from home. If I didn't want to see anybody, I never had to see anybody. Frontline staff did not have that luxury. So what do these findings mean for policy practice and future research? Well, based on this research, we identified several opportunities for organizations and decision makers in the sector to improve the working conditions for their frontline staff. And one key area for improvement is providing frontline workers with the necessary training to do their jobs safely. And the surveys and interviews highlighted a set of 7 core trainings that all frontline staff should receive, which are first aid and CPR, nonviolent crisis intervention, principles and practices for harm reduction, suicide prevention, knowledge of homelessness, training to manage and address aggressive behavior, and training to prevent and respond to sexual harassment in the workplace. We also identified other opportunities for policy and decision makers, as well as organizations in the sector, to improve working conditions. And this included exploring how sustainable wage enhancements can be implemented for frontline staff. And this would help to address issues including precarious employment and employee retention and turnover. And the survey interviews also revealed certain inadequacies in the availability of different supports and benefits, including paid sick days, paid vacation days, health insurance, daycare, and mental health counseling. And so organizations in the sector should seek to ensure that the physical, mental, and social well-being of their frontline staff are supported by ensuring that they have adequate amount of necessary supports available to them. We also identified that an assessment of the adequacy and availability of training, physical resources, financial resources, and human resources related to COVID-19 is needed to ensure frontline staff are working in safe conditions as the pandemic continues. And while we've recorded some experiences of discrimination in the sector, more research is certainly needed that focuses exclusively on this issue to better address discrimination in the workplace, in this sector specifically. And that concludes my presentation. Thank you.